Welcome to HNHN Daily. I'm Susanna Hopsollerin, Senior Editor for Hospitals and Health Networks magazine. In small cities with high unemployment and poverty, the community often struggles to keep their hospital open. In 2002, Franklin Hospital nearly closed. The board, along with local elected officials and the community, came together to keep the doors open. The residents of the county raised over $40,000 to cover operating expenses until a loan was secured and the hospital attained critical access hospital status. Today I'm joined by Hervey Davis, CEO, Franklin Hospital from Benton, Illinois, and Tammy Tiller-Hewitt, CEO of Tiller-Hewitt Healthcare Strategies in the greater St. Louis area, to discuss the strategies that put Franklin Hospital on a path to sustainable growth. Welcome, Hervey and Tammy.
Thank you for having us.
Great to be here.
Hervey, can you describe for us the situation that Franklin Hospital faced?
It was an interesting time. I arrived at Franklin Hospital on April 15 of 2002. It happens to be tax day, so it's an easy day to remember. The hospital board had just voted to close the hospital 5 weeks from that date. And what we essentially did is we transitioned from a prospective hospital to a critical access hospital. We borrowed $4 million from the federal government through the U.S. Department of Agriculture. And by the way, that required a waiver by them, but they were most helpful. So with that startup capital, we were able to start going again. We became a critical access hospital. That meant we got cost-based reimbursement on the Medicare side of things. And, we have tried to run it like a good business should be run all the time. Our hospital happens to be a governmental entity, so we're a public hospital. That brings other interesting challenges, but that does allow us to raise a bit of tax revenue as well. So we have really, if you look at the community, we have really done all the right things to provide funding in a tough situation.
Physician engagement and physician relations are probably one of the keys to the success of a critical access hospital. What kind of a program do you recommend putting in place to really ensure that that is viable and physician recruitment is sustainable, Tammy?
So the key elements of the program really are consistency. So it starts with the CEO announcing to the medical staff that we are launching this program, what you and your staff have to say about the way we care for your patients and the way we serve you and your staff is important to us. And then really the key element is getting someone out in the field consistently working with physicians and their staff. So not just stopping by once a year, a couple times a year, hey, here's my phone number, call me if you have any concerns, but it's someone going out to their turf and talking to them in their environment to understand what their needs are. So it's really about uncovering needs and then bringing those back to leadership.
And I would add that if the CEO is not involved in it, in let's call it enforcement, let's say someone comes back and they say, gee, we would love to use your laboratory, but every time we go there, we have this individual that's hard to deal with. Well, somebody needs to be able to go to your lab management and say, we need to fix that. And so if you don't have strong support from the executive suite, you really don't get it done.
So the liaison really serves as the messenger. He or she are out in the field collecting intel on what's making us better or where we're having business leak from our market because we're not offering the same level of service that our competition is. So that's the information that can be brought back every single day to make the organization better, to be able to earn this incremental business. And I might add, it's generally business from our backyard that we're losing for services that we offer.
Hervey, you're kind of a genius at data analysis and really getting into the heart of what's going to be the primary growth opportunity. Share with us a little bit about what you found to be the greatest opportunity.
For our hospital, what we really do is we try to tie our reimbursement and our volume back to every month, that on the first day of every month I will download data, I will run a report, and I'll find out what my payer mix was and how much revenue I produced. And so I want to know, you see, my expenses don't really change very much. And I have a group of managers that are very good at pinching the head of Lincoln off of the penny, okay? So that part of it takes care of itself, kind of. So what I really need to know is how much revenue did I produce, in what areas of the hospital, and how can I improve that?
If Herbie wasn't looking at that data on a monthly basis, we would not know until the business was completely gone that practice was not using us anymore. So you have to look at data, and you have to look at it on a physician by physician level or advanced practitioner.
What are the biggest barriers to sustainable growth?
You cannot find a more difficult market to deal with, I would say, though, than healthcare. I mean, we really do have our challenges, but it's a great place to be, and I can't imagine having not done what I've done in my career. It's been great. So it really comes down to energy and just taking the time to put your thinking cap on is what it really comes down to. What are the barriers? We have plenty of competition in Franklin County. People have a lot of choices they can make. So how do you change it? You sit down and you figure it out.
Thanks for joining us today.
You're welcome.